We are happy to have you back for another episode of Optimal Anesthesia, in which we demystify complex medical concepts and investigate their practical applications. Today, we'll be talking about addiction and the role that genes play in the disease, particularly in the context of anesthesia intervention. Misconceptions and prejudices about addicts have been around for a long time. However, the tide is turning. Addiction is now understood to include more than simply a lack of or surplus of willpower. Variables interact to cause this complicated illness. That's why we're delving into genetics, one of those important aspects. Now imagine that you are in the operating room. Your anxiety is understandable. If I told you that your genetic makeup may affect how you feel pain, how will you tolerate painkillers, and whether or not you develop an addiction to them after surgery, would you believe me? This is the topic we'll be delving into more. To that end, let's go down to fundamentals. Substance addiction, whether to drugs or alcohol, is affected by a number of variables. These include genetics, environment, developmental factors, and social influences. Our current area of study, genetics, is an important part of this. Consider it nothing more than the unique blend of DNA you received from your parents. A person's vulnerability to addiction may be altered by this genetic code. Let's start with a gene called DRD2. It encodes a receptor in your brain's reward system, closely linked to addiction, especially alcoholism. If you have certain variations in DRD2, you might be more prone to addiction. Now, how does this relate to anesthesia? Well, these gene variations can affect how you respond to pain management during and after surgery. If you have these mutations, you might need higher doses of opioids, and that directly influences the anesthesia medications we choose for you. But the story doesn't end there. We have our second character in this genetic tale, the GABA receptor genes. They play a role in inhibitory neurotransmission in your brain. And yes, you guessed it, they're linked to alcoholism too. So, here's where it gets interesting. DRD2 mutations can also interact with these GABA receptor mutations, increasing the risk of addiction. This has an impact on the sedatives and anesthetics we choose. It's a real genetic twist in the plot. Next up, we have serotonin receptor genes. These genes are key players in mood regulation and are, of course, linked to addiction. Certain anesthesia drugs interact with these receptors, like antidepressants and pain relievers. And here's the kicker: genetic variations in DRD2 can affect these serotonin receptor genes, potentially raising the risk of addiction. This means we have to be extra cautious when prescribing medications that interact with serotonin receptors. Finally, we have the COMT gene. It controls an enzyme responsible for metabolizing neurotransmitters like dopamine and norepinephrine. Once again, we find a connection to addiction, especially in how it relates to pain management and sedation during surgery. What's fascinating is that COMT mutations can also interact with DRD2 variations, primarily in terms of dopamine regulation, potentially heightening the risk of addiction. This brings us to the critical point: the importance of personalized anesthesia medication choices for pain control and sedation. Genetic research doesn't stop there. Genome-wide studies scan the entire genome to pinpoint genetic regions implicated in addiction. These studies can help us understand the shared genetic factors involved in addiction. Genome-wide linkage studies. Genome-wide association studies. For instance, the Collaborative Studies on Genetics of Alcoholism, COGA, which has been active since 1989, has detected several genes linked to the risk of alcoholism. Heritability plays a critical role. Studies show that genetics might account for at least 50% of alcohol addiction risk. If you have a family history of addiction, especially alcoholism, you're at a higher risk. But it's not a one-size-fits-all genetic story. Now, let's bring this back to the world of anesthesia. This genetic information can play a critical role in perioperative management, from the moment a patient walks into the operating room to their recovery. Perioperative management involves careful planning and execution. It's here that we can use our knowledge of a patient's genetic risk factors for addiction to make a real impact. The preoperative assessment becomes essential. Knowing a patient's genetic risk factors for addiction can help tailor the pain management plan, ensuring they get the right pain medications for their unique genetic profile. Medication selection is another crucial factor. Patients with specific genetic variations might respond differently to certain medications. Tailoring the medication can improve pain management and reduce the risk of complications. Monitoring and education are key. Educating patients about the risks of addiction and monitoring them closely for signs of tolerance or withdrawal can make a significant difference. In some cases, alternative pain management techniques, such as nerve blocks or regional anesthesia, can reduce the need for opioids and minimize the risk of addiction. Postoperative follow-up is the final piece of the puzzle. Continual assessment after surgery helps prevent the escalation of addiction and ensures that pain is adequately managed. There you have it, a deeper understanding of the genetic factors involved in addiction and how it relates to the world of anesthesia. Remember, as an anesthesiologist, you play a crucial role in ensuring patients' safety and well-being during surgery. Thank you for joining us on Optimal Anesthesia. We hope this episode shed light on the connection between genetics, addiction, and perioperative care. Stay informed, stay vigilant, and keep listening.